On the 28th of July, we held a remarkable event. 4,700 health professionals had registered for this event, including 2,469 francophones. We wanted to check in with you and to again, since the 28th of July, for those of you who participated in that event, to ask you to share where you're at on this question, starting with a very simple question. Do you consider climate change to be a threat to the health of those you serve? So we'll start with Kingsley Nniere, who has a microphone unmuted. Kingsley, first of all, were you there on the 28th of July 2023 event?
Yes, thank you very much for this wonderful opportunity. I'm Kingsley Nniere, working with Community Youth Development Foundation as a community health worker. Yes, climate change is a threat to health in the Kintampo municipality. Why am I saying so? We are currently in the rainy season, and there is severe downpour of rains. And then, as there are downpours of rains, what happened here is that most of the rivers are flooded, and most of the gutters are flooded. And what happened here is that it breeds a lot of mosquitoes. And these mosquitoes bite the community members, and by so doing, it gives them malaria. So by so doing, I can say climate change is actually a threat in the Kintampo municipality.
Thank you, Kingsley. All right. So what you told us, we asked 4,700 people, 1,234 responded with detailed context-specific observations. The first thing we learned is that, and we confirmed, let's say, is that most of you who work at the district or facility level, primarily in smaller communities, tend to be, as health workers, considered by the community as a trusted friend or as part of the family. You can see that's over 80%. And then overall, when we asked you, is climate change a threat to the health of the community that you serve? You can see that most of you, over 600, gave it the highest threat level. And you also personally worry as health workers about climate change. So that's what you told us. That's what 1,234 of you told us. We're here to listen to you now around this same question. And our next speaker will be Ismaila Edego. Ismaila, we'd love to hear from you. Do introduce yourself and tell us, is climate change a threat to the health of those you serve?
Good morning, good afternoon, good evening. Am I audible enough over?
Yes, loud and clear.
Yeah, my name is Ismaila Ibrahim Edego from Kaduna State, Nigeria. I'm an independent immunization consultant. I will say yes, that climate change is a threat to the health of the people around me. The reason being that these rains comes with a lot of flooding, like the last speaker said, and then this affects the farms of these people around. That most of their houses, their farms were flooded with rain, and then because of this, there's a lot of hunger because their farming activities have been affected. And apart from that, the flood comes to a lot of diseases like cholera and malaria, such that even getting immunization to these people becomes a little bit difficult because they kind of have a two-edged sword where you have to first of all empathize with them regarding the circumstances they find themselves when their farms are flooded. Some of them are having issue of cholera, malaria, and then we have to bring so many interventions in order to ensure that our immunization activities even have a success. So climate change is real and it is around us. And then the best way we can do to help these people is to collaborate with other organizations and agencies that are into climate change so that we can sensitize our people regarding the rains. There may be areas which are kind of flood prone so that we will know how to go about their agricultural activities so that they can mitigate such cases. If not, we are going to have a lot of challenges to overcome in terms of the health of the people on one hand and how to get immunization to them on the other hand. Thank you and over.
Thank you very much indeed, Ismaila Edego. Now, in thinking about these issues, we're talking about two very complex changes. First of all, are changes in health, and you can see here everything from anxiety, depression, cardiovascular, cerebrovascular diseases, cold-related illnesses, disruption of healthcare infrastructure. You already know many of these as health professionals, and you can see these changes in health. Here, heat-related illness, malnutrition, occupational health hazards, post-traumatic stress disorder, non-vector-borne infectious diseases, vector-borne diseases, skin conditions, waterborne diseases, and so on. So those are the ones you know as infectious disease workers in immunization, or if you don't work in infectious disease, you're still, these are part of your world as a health staff. But now what we're thinking through since the 28th of July is, what are the connections between those changes and changes in the environment? And you can see some of the possible changes. It's for you to figure out which ones of these are relevant to your context. Is it a change in weather that has led to an increase in food spoiling pests? Is it drinking water that's become less clean or harder to access? And these are changes in the environment. They may or may not be the result of change in climate, which is much longer term. Flooding, drought, damage to water pipes that affects the water supply, rainfall more or less frequent, the air has become less clean, the ocean is warmer, the sea is encroaching on the land, the sun has become stronger, there have been more frequent big storms, floods, long dry periods, or wildfires. Urban areas are becoming hotter due to less nature to cool them down. Now, if any of these rings a bell, you say, yes, this is happening in my community, you may want to consider this question. Is climate change a threat to the health of those you serve? Dr. Tuusime Ramadan, you live in Port Fordel on the border between Uganda and the Democratic Republic of Congo. Please introduce yourself and tell us, why do you think climate change is a threat to the health of those you serve?
Thank you, Reda. Are you getting me clearly?
Loud and clear.
This is Dr. Tuusime Ramadan from Uganda, a retired medical doctor, working for a community-based organization called Humanitarian Volunteers International. We are an implementing partner for organizations, and we do voluntary work. We are working across near the Congo border, and outbreaks spill to our country. Climate change has caused problems to very many people we serve. For example, rain season. The rain season now is not timely, and when it rains, floods come, they destroy homes, destroy crops, and they destroy houses. So they affect our work of immunization. The sun has become so hot that even other people get mental disturbance because of the sun, and that's also affect the population we work with because of the results of the climate change. Floods, for example, we are under Rwenzori Mountain in Uganda, in Kasese district. So the floods, Kabarula and Kasese district, the floods have swept villages and houses and hospitals. So our work has become difficult because of that. Climate change. I'm the country director of the Volunteers Association, and we work with volunteers. So we are contracted by the government to do immunization, but climate change has done harm to us. Cultivation has become difficult because of the rain sweeping the crops and the heat killing seeds. And so there is hunger. So if there is hunger, our work is not done well. Animals, we are pastoralists and animal keepers in this area. So animals die due to drought, less of food, lack of water. So that affects the community we work with. So climate change has affected the work we have been doing. Bad water. So when floods come from the mountains, we are under Rwenzori Mountain. So waterborne diseases, many people get sick. So it's a problem to us. Storms. Very big storms come with winds and sun. So they affect communities. And lastly, that's the challenge we meet in our work because of climate change. So if there are any other questions, Reda, you can ask me so that I can answer them.
Dr. Tuusime Ramadan, no further questions at this stage. Thank you. All right, wonderful to hear these voices, your perspectives, seen from the work that you do. Many of you, but not all, work in immunization. Charlotte, back to you to indicate who shall be the next speaker. I see many women actually who have their microphones activated. We'd love to hear perspectives from both men and women from as many different countries as we can. Who shall be our next speaker, Charlotte?
Thank you, Reda. I'm inviting the women. I see Flora for you. If you can tell us if climate change is a problem for the communities you serve. Okay, Rebecca Bello, you're first to unmute yourself. Over to you.
Okay. Hello, everyone.
Hi, Rebecca. Don't forget to introduce yourself.
Hello, can you hear me?
Yes, loud and clear.
Yes, my name is Rebecca Bello from Abuja. I work with the University of Abuja, Department of Community Medicine, and I'm a volunteer in the primary health care that was attached to the university for the doctors' training. So the climate change has really affected the community where we do carry out community diagnosis, and we do visit them for health talks and others. So and even research. In the process of one of our research, that was when we come across a particular community along Kuje axis, that's Kuje Area Council. And the community, they were having issue of flood. But then, if the flood is over, it will wash away the whole farm produce, and then again leave them with disease, because they don't really have river in that community. It will create some kind of stagnant water pond all around them, and that is where they have their drinking water. That's where they breed their animals. They do all their activities, both human and animal activities take place there. And it was the same community that we discover FGS, the high level of FGS, because most of the especially they were complaining to us of how they cause for concern. And in fact, we are still planning on how to revisit the community. And
all right. Unfortunately, I think we're losing Rebecca. This sounds like a Nigerian telephone network when it does not want to work. But we got the gist of it. Really interesting, the connection you made to female genital schistosomiasis. So that's FGS, and that is actually the topic for the next session, which will be starting in 16 minutes. I believe we've completely lost Rebecca, unfortunately. All right, let's go to, let's see. All right, so our rules of equity, Charlotte, say that after a Nigerian speaker, it should be someone who is not from Nigeria. So if you are from a different country, please, we'd love to hear from you. The question is actually very simple, we hope, but it's complex unraveling it. Do you consider climate change a threat to the health of those you serve? So let's go to, let's keep trying. We have...
Earlier on, Uziku Tolberg had his hand raised. I don't know if, and I'm sure he's not, I hope he's not from Nigeria. So there was also Hassan Balde.
All right, let's keep going, and we'd love to hear from you, Hawa Buhari. We know many of you are committed leaders for immunization. Let's go to Atahir Abubakar, and we're proud to have such a large, active, and dynamic Nigerian community. Just so there's nothing equivocal about that, we just want to ensure that participants from as many countries as we can, that their voices are heard as well. So let's go to Atahir Abubakar from Nigeria, and then we'll go to Ezeani, and we encourage, of course, gender balance, which can be hard to achieve. But Atahir, how do you answer this question? Don't forget to introduce yourself, please.
Okay, thank you, Reda. Good morning, good afternoon, good evening. I'm Atahir Abubakar from Nigeria. Climate change has a big threat to the health of those we serve in a variety of ways. Though I've put some on the chat box, In agricultural areas, because of the drought, most of the communities now cannot the yield is very minimal, very poor, and cannot feed the communities. So they end up begging, they end up, malnutrition has started setting up in some of the community because they cannot afford to feed themselves even 2 square meals. So the moment there's malnutrition, we know the health condition of those community is at risk. Then secondly, the climate change has caused some of in the urban areas where there's heat waves, pollution has set up. Just last week, I think even me, I was seriously down with asthmatic attack because of the pollution in the environment. So a lot of people have been complaining of having upper respiratory tract infection of recent because of the pollution, and which has been attributed to the climate change globally. Thank you, Reda, and over.
Thank you very much indeed, Atahir Abubakar. We have Bernard Bediako, who is going to be our next speaker. Bernard, your hand is raised. We'd love to hear from you. Is climate change a threat to the community that you serve as a health professional? First, introduce yourself, tell us what you do, and tell us maybe a little bit about the community that you serve, whose health needs you serve.
Okay. Thank you very much, Reda. So my name is Farm Bernard Bediako. I am the District Director of Health Services for Amansia West District in Ghana, specifically in the Ashanti region, where Amansia West is one of the 6 deprived districts in the region. If you look at Amansia West, it's basically a mining area, both legal and illegal. And then also, we have very deplorable road network on tarred roads, virtually in the entire district. So with these two combined, and one challenge we have is that because of the mining practices, we have a lot of uncovered mining pits, as well as lands that have been left devastated as a result of the mining. And so as a consequence of this, you would realize that when you look at our top 10 morbidity cases, we have malaria as number 1, we have diarrheal infections as number 2, we have upper respiratory tract infections, and then intestinal wounds. And these are very much of concern to me as the District Director of Health Services. So what would I have to do? It meant that I have to engage the political leaders, the community leaders, the mining organizations themselves, and let them know the threats of the mining, and then leaving the pits uncovered and the lands unreclaimed. And so through that, we have had a lot of engagements, and I'm sensitizing them on that. Again, too, we are having community meetings, and then going to the marketplaces, as well as to the miners themselves, engaging them with the hope that as we continue with this education, they would be able to, as it were, do responsible mining, wherein you will have these morbidities coming down. So that is one challenge that we have. Because, with mining, they use a lot of chemicals. And these chemicals, when ingested, have a lot of health implications on the kidney, on the liver, and also would lead to deformities in some of the children or the babies that are born. So this is a challenge that we have. But through community engagement, we've realized that we have seen some improvement along the line. Thank you very much.
Thank you very much indeed, Bernard Bediako. And you've actually shifted us. This is a perfect transition, because the second part of the discussion and the sharing of experience that we were hoping to have is around these two questions. Is one, what can you do as a health professional to support your community that is changing, that is facing these changes that are affecting their health? And what do you want your country and global partners to do. So for the next, the remaining speakers, we'd like to ask you these questions as well. It seems obvious that most of you do agree that climate change is a threat to the health of a community that you serve. Charlotte, back to you to help us find the next, maybe one or two, possibly three final speakers.
So Reda, we have Eziani Nwane Dinamba, whose mic is already unmuted. So I hope you don't want to respond to the first question, but instead to the second set of questions. What can we do as health professionals? So over to you.
Eziani, do introduce yourself first. Tell us who you are, what you do, and then what you're in the face of these changes. Unless you disagree and you don't think that climate change is a threat, you can skip right to these questions, please. But do introduce yourself.
Good evening, all.
Yes.
Can you hear me?
Yes, loud and clear.
Okay, well, my name is Eziani Anthony Nwanetnamba. I came from Nigeria. I am a sustainable advocate and climate actor. I'm also ambassador to Geneva alumni. I'm very happy to be here today. The question, and also I'm also administrative officer at the Federal Polytechnic here in Nigeria. The question that I'm going to ask is that the effect of climate change on the health of us, everyone. We all know that climate change is a change in weather and temperature over a long period of time, but because of human activities, it happens often. And those human activities are the increase use of coal, oil, and gas, and also increase in population, and most important thing, it causes a lot of, wildfire, drought, land degradation, and also flooding. Most important thing is flooding that's happening right now within some of our communities and causes a lot of problems in terms of clean water and sanitations, where the children's drink waters, and if that waters are not clean, it affects them, causes a lot of waterborne disease to them. So it's an adequate and most important thing that we need to come together to combat the climate-related issue as a threat to us. The second question, what can you do as a health professional to support your community? Most important thing for health professionals is networking, coming together as we are here today, sharing experiences and the knowledge gained that will facilitate us in all the challenges we are facing as health professionals, where we come together, work as awareness volunteers in our communities to reach the zero-dose children wherever they are, find them, knowing that a lot of zero-dose children in our community, but to find them is difficult because some people don't have the strategy how they can locate them. But we know that there are thousands of them, and as health professionals, we need to come together, work in a common purpose to bring out all the zero-dose children around our community. Most important thing is building a capacity building, networking workshop, and also have experience sharing as we are doing today. It will help us to support our community in terms of health. The second one say, what do you want your country and global partner to do? Most important thing, in my country, Nigeria, we need a vaccine. There's a lot of zero-dose children in our country that we need to work on. We need to find them in the far north, in the far east, in the west. There are a lot of them, millions of them. So we, as the movement ambassadors, we must try our best to locate them wherever they are, knowing that those children haven't taken vaccine before. And most challenges sometimes is that we need to get their parents, contact their parents and go to house to reach them. And most important thing, because we know that this time things are very difficult and transportation are very, very difficult for some parents. So if you can able to bring any program closer to this community and bring them together, I think they were able to, mostly to fight vaccine hesitancy and lack of confidence in vaccine, so that we will get all these zero-dose children within our country. Thank you.
Thank you very much indeed. Now we only have less than 5 minutes left, so maybe Charlotte, we shall hear from one more person. Is it Hawa Buhari or Lucy Adebayo? Charlotte? All right, and Charlotte herself may be having connectivity issues. Hawa Buhari, would love to hear from you.
Okay, good evening or good afternoon, good morning, wherever we are. It's good to be here. I'm Hawa Buhari I work on the UNICEF project in Sokoto, Nigeria. And okay, 2 questions that you asked. As a professional, I think you should begin to prepare.
I am very sorry, Hawa, but there's a problem. Yes, unfortunately there's a problem with your line. It's a very choppy sound. Charlotte, can you confirm it's the same for you?
Yeah, it's the same for me. Reda, I don't know if you're using a headset. Maybe you.
Is there a way you can fix your microphone? We'll try to come back to you. In the meantime, we'll go to Lucy Adebayo. Lucy, a warm welcome to you. Tell us who you are, what you do. It's still choppy, so there does seem to be a problem with probably your microphone or the line that you're on. Lucy, a warm welcome to you. If you can fix that, we'll come back to you. But we have only a few minutes left. I suggest you share in the chat. Lucy, introduce yourself, remind us who you are, what you do, and then what do you consider you can do as a health professional to support your community, because these changes, health effects of climate events, are already happening. So 2 questions before you.
Okay, hello everybody. My name is Lucy Adebayo. Can you all hear me?
Loud and clear.
Okay, I'm a pharmacist and a public health practitioner specialized in health promotion and disease prevention. Am I clear?
Yes, perfectly. You're coming in perfectly. Can you tell us? Tell us if you disagree that climate change is a threat to the health of the people who come to your pharmacy to pick up their medicines, and that you advise and counsel. And what can you do as a health professional to support a community as it's facing some of these changes that are likely climate related?
Okay, thank you very much. I would like to state that this is my first time here, and I have learned a lot attending today. What I can do as a health promoter is to continue to educate members of the community. Everyone needs to be aware of the negative impacts of climate change. It's funny, and there should be this multi-sectorial approach to solving these problems. Only the health sector cannot tackle it. So all sectors should come together and make it a priority. Thank you.
Thank you very much indeed, Lucy Adebayo. And we're going to offer a round of applause to you, Lucy, because this was your first Teach to Reach. That is how we do it. And a warm welcome to the Teach to Reach family. We're going to announce the date for the next Teach to Reach, which will be in March 2024, very soon. And we hope you'll be with us. You'll come back for more learning and sharing of experience. I also want to acknowledge the great messages in the chat. Some very interesting comments. Ismail Farouk Umar, who says climate change largely contributes to malnutrition, other disease outbreaks. Now, one thing to keep in mind is there were disease outbreaks and malnutrition before the climate changed. So keep that in mind. It's extremely difficult to unravel the causal relationship, the cause and effect relationship between the two. But there are undeniably, and you seem to be confirming it, ongoing changes. Ismail Farouk gives a specific example from Gombe State of a high incidence of snakebite. That is it for this session on the health impact for local communities and the front lines of climate change.